All right, so this week we're going to be talking about your nervous system. So before all of this, we were talking about how we got medicines to market, how the drugs came to be, how drugs act once they get in the body, processes of pharmacokinetics, pharmacodynamics. We talked about differences between like genders make and genetics makes and all this stuff. Now what we want to focus on is we've got the drug in the body. Now what? How does a drug know where to go to make things happen? So understanding that the way that drugs work is a lot like a lock and a key. Some people could say a lock and a key, so only one lock fits into one key fits into one lock, and it's going to open that. The way that the body works, it's a little bit different in the fact that sometimes one key will open more than one door. Okay, so kind of think of it as like a master key. We don't really have a master drug that opens all the doors, but we do have a key that opens up several different locks. So learning outcomes this week, remember to follow the helpful little symbols along as we bounce through the lecture so that you can kind of figure out where you need to put your focus at for the different learning outcomes. We do have quite a bit of learning outcomes this week, but we'll make sure that we get through them all. Next slide. Last set of our learning outcomes. I'm not going to read them to you. You guys are smart. Okay, here's where we need to spend a little bit of time camping out. So with your body, you have your nervous system is kind of broken down into some parts. Thank God for nice slides that have all this beautiful stuff on there so that we can see kind of pictorially how your body is broken down, because you're a very complex human being, baby girl or baby boy, whoever's listening. Okay, so with this slide, what I want to show you is that you've got your central nervous system, which is basically your brain and your spinal cord, and then you have your peripheral nervous system. And then your peripheral nervous system gets broken down into like further parts. Where we're going to be spending a lot of our time at today is going to be in the autonomic nervous system. And specifically, we're going to be spending some time in both our sympathetic and our parasympathetic divisions of our autonomic nervous system. Within those divisions, they have specific locks and keys, locks that certain keys can fit into. So if you think of the receptor as being the lock and the drug being the key, they can open and turn things on and off based upon which system that they are specifically addressing. Again, this is nothing that nursing had to figure out, but I will tell you that chemists and scientists spent a long time in a lab watching mice, monkeys, and humans as they gave them different medications to find out what the reaction of that medication was going to do to that person's body. So we're really getting down into the nitty-gritty of how medications affect the actual cells. So you may be asking yourself, why in the world do we need a parasympathetic and a sympathetic division? Well, let me show you. If we didn't have both of these sections, this is how we would live our lives, just all the time, a cat on the ceiling. We really have to have this balance between good and evil, between evil and good, so that we can live kind of in like this harmonious state. This really becomes a push me, pull me kind of a moment with your body. The reason I say that is because the body doesn't always like to live up here in the sympathetic. It doesn't always want to live down here in the parasympathetic. It's got to have this nice balance to be complement. When we need to activate our sympathetic nervous system, we need to go. But whenever there are times when our body just needs to sit down, take a moment and break and do some different activities and functions that our sympathetic nervous system can't do because it's pushing all the resources to get you out of the situation that you've got into, okay? There's only one, almost every organ in your body actually has a parasympathetic and a sympathetic division, with the exception of blood vessels. With blood vessels, they live under sympathetic tone. So for the most part, your sympathetic division keeps your blood vessels kind of like up and proper and erect. If it was the parasympathetic's job to actually monitor and to like take care of your blood vessels, it'd be like, dude, no man, you just need to chill. Well, if you chill too much, you don't have a pressure, okay? So the sympathetic system is the only system that controls the tone of your blood vessels. But for the most part, everyone else is innervated by both the yin and the yang, by both the sympathetic and the parasympathetic division. They have to work harmoniously or things don't work right. So you may be asking yourself, how is all this messaging getting around? Well, there's a couple of different ways that your body sends signals up and down the chain. Your brain sends some, you've got this feedback regulation system going on. Think of it kind of like the air conditioner in your house. You know, we set the air conditioner in our house, our AC systems, we want to, like say, keep the house at 74 degrees. Well, the system has to turn on and regulate the system to get the feedback from the house to see whether or not it needs to turn on the air or turn the air back off. Well, that's kind of like feedback regulation. Your body does the same thing. It's constantly checking on you. The other thing that happens is that you have this thing right here called your baroreceptor reflex. You have these sections in your aortic arch right here that are constantly monitoring the tone and kind of filling out what's going on in your body. So those actually tell you. And then again, we already kind of talked a little bit about autonomic tone. I'll be all right. Let me get that out of there. Hang on. This autonomic tone is kind of what helps to maintain the tone of your blood vessels, the tone of your body, so that you're always not just passing out on the floor or acting crazy. Okay? So neurotransmitters. So we talked about that your body is constantly getting messages from everywhere. Well, the body can't like the brain cell can't leave the brain to go tell the lung what to do. So it has messengers, also known as neurotransmitters. Acetylcholine is one of the main neurotransmitters. It doesn't matter if you're on the parasympathetic side or on the sympathetic side. Acetylcholine is your guy. He's always there. Okay. Now sometimes, well, not sometimes, in our sympathetic nervous system, it uses both of them. It uses both acetylcholine and norepinephrine. And we'll talk more about those as we go along. But for the most part, I just want you to understand that your body is sending these messengers, aka neurotransmitters, around the body to talk to the different receptors and then to talk to the specific cells that are within your body. So the receptors and the cells. Neurotransmitters make it happen. I'd like to show you just kind of the basic structure of the autonomic pathway. I will tell you that we can get into some pretty intense, deep discussions about what's happening here between the ganglionic synapse. Sometimes the reaction happens on this side of the synapse. Sometimes it happens on this side of the synapse. Sometimes it's happening just at the target organ. I just want you to know that chemists are incredibly smart and they can design medications that literally are on this side of the synapse, not on this side. Or they can develop medications that are hitting on this side of the synapse, but not on this side of the synapse. Dudes, that is talent, just raw talent. So we're going to kind of dive into our first system. The first system that we're going to talk about is our parasympathetic nervous system. I know, I brought a pig. So the parasympathetic nervous system will be represented by our friend Piggy here. Because the parasympathetic nervous system is our feed and breathe system. Okay, not saying that it's a bad system. I mean, parasympathetic nervous system is pretty stinking cute. Okay, so that's going to be part of our discussion is the parasympathetic nervous system, your feed and breathe, your rest and digest system. Guys, if I had my choice, yeah, we would just rest and digest all the time. That's a great system to have. But unfortunately, that system does not allow me to finish this lecture. So we will activate my sympathetic nervous system and get moving. Okay, this is the chart from your textbook, and it's a chart that you can find online anywhere. It lays out for you side by side the difference between the parasympathetic division and the sympathetic division. I'm telling you, as a future nurse, as someone who shall go on to give medications to all people and to give them safely and adequately and within your parameters of a nurse, you're going to have to put this stuff in your brain, okay? You can't, there's no way we can get past it. I'm going to tell you right now, you will fail your upcoming exam if you do not put this in your brain. It is so important for you to do. Miss Hardy, how am I going to do this? Well, I'm gonna tell you how you're gonna do it. You're gonna take yourself out a piece of paper and you're going to take this chart and you're gonna draw it until you get it. You understand? If you don't work with this chart as from this point forward till we are done with this class, you are going to suffer. Do not suffer, children. Get out a piece of paper and make yourself a chart. Okay, so let me show you what this student did several years ago. So I challenge all my students to learn what the parasympathetic and the sympathetic divisions do. And so by golly, she was going to get it in her brain, and she went home and she practiced it. She knew that she was a kinetic learner. She knew that she couldn't just look at a chart or just listen to Miss Hardy talk about it. She's going to have to physically sit down and make herself a chart. And she did. So I know it's a little hard to see, but that's her shower door. And the chart is on the shower. I love this picture. It's one of my favorite. It hangs up in all of my offices. So again, here's her sympathetic division, her parasympathetic division. She drew little pictographs as to what would happen with each one of those systems was having an agonist reaction and wrote them on there. And then she put some lovely artwork around here about all things drugs. But yeah, I've had this since 2009. When I first started teaching pharmacology, and actually when I first took pharmacology for the first time, as an undergrad, this section of the textbook blew my mind. It was difficult to wrap my head around. I will tell you the best way to do this is you have to make your own chart. So even Miss Hardy has a chart, okay? This is literally the back of my calendar. I wrote my chart out on the back of my calendar, and then when I'm studying pharmacology or I'm teaching you pharmacology, I actually post this in my office, right where I can always lay my eyes on it so that I can remember what each of these drugs are going to be doing whenever they hit a specific receptor site. So you're going to have to work on this, people. There's only one way to do it. You got to practice it. All right, next slide. So remember, again, our parasympathetic nervous system, main function, feed in, breathe, or rest and digest. I could go to sleep right now. All right. This little chart is just a very, very simplistic breakdown of what your parasympathetic nervous system does in order to get drugs through your body, okay? So here's how it goes. So what happens is that the parasympathetic nervous system gets activated and it says, hey, we're in a feed and breathe, rest and digest situation. And it says, hey, autonomic nervous system, tell everybody to chill. So it's buddy, acetylcholine, which is the messenger, the neurotransmitter for the parasympathetic nervous system, says, no problem, autonomic nervous system, I got this, hold tight. And it runs down and it grabs the parasympathetic nervous system. It says, hey, just want to let you guys know we're relaxing here. We're gonna just take it down a notch. And it runs through the parasympathetic nervous system. It's got it activated now. It's looking for these receptors. They're called cholinergic receptors in the parasympathetic nervous system. And it goes to the cholinergic receptors and says, hey guys, listen, I need you to tell everyone the boss says we're gonna like shut her down. We're shutting it down. We're gonna rest. Got it? And then it goes even further from that because it keeps running and it touches all the messengers or all of these cells that are actually physically in the body. So within the body of the parasympathetic nervous system, we're looking at three major cell types: nicotinic M, nicotinic N, and then muscarinic. Now, honestly, guys, nicotinic N is kind of found over like most of the autonomic nervous system and in the adrenal medulla. The nicotinic M is kind of on the neuromuscular junctions. And so like whenever they're activated, they'll actually kind of make you move. But the muscarinic receptors is where we kind of get the most bang for our buck when we're talking about the parasympathetic nervous system. Muscarinic receptors are found on almost every major organ group throughout the entire body. So a lot of the pharmacology that we're going to be talking about is targeting the specific cell, the specific receptor on that organ called the muscarinic receptor. And our acetylcholine guy is the guy who will be taking this message to the people, to the body, to the organs, to the cells. So cholinergic drugs is kind of the way that we describe medications that work with our parasympathetic nervous system. So these drugs can either turn on, turn off your cholinergic receptors. The first set of drugs that we're going to talk about are the ones that actually activate your cholinergic receptors. Now then, I got a little test for you here on the screen. I want you to take out your tool, that would be your chart. Okay, take out your chart, and then we're going to answer through these questions here on the screen to kind of start testing your knowledge about whether or not we've got, what kind of reaction we have going on if we turn these receptors on. Okay, are you ready? Eyes, constricted or dilated? Constricted, good job. Salivation, increase or decrease? Increase. Bronchioles, increase or decrease? Decrease. Ooh, decrease the bronchioles? Miss Hardy, isn't that bad for some patients? You're right, that could be bad for some patients. Bronchial secretions, increase or decrease? Increase. Now look guys, if you can remember that the patient has increased salivation, then you can remember that the patient has increased bronchial secretions. Okay, there we go. All right, cardio, heart rate, increase or decrease? Decrease. Blood vessels, increase or decrease? They're going to dilate. GI system, increase or decrease? Now remember guys, I told you that this is the rest and digest system. So if we're going to digest things, we got to pull it through the system. There's only one way to pull things through the system. You only can pull the crap through one way. That's increased peristalsis. Increase, there you go. Secretions, increase or decrease? Remember, I told you that activation of this system causes an increased amount of salivation. If it increases secretions in the mouth and in the gut, it's got to do it in the bronchioles, it's got to do it in the gut too. So, increase. Okay. Constipation or defecation? Okay, I told you, peristalsis, if it's increased, there's things moving down there. We got crap moving. So literally, this patient's going to defecate. All right, urination or retention? Urination. Erection or impotence? Erection. Okay, feed and breathe. There you go. What about sweating? Increased or decreased? If you can remember that they're going to have more spit, then you can remember that they're going to sweat more too. Okay, increased. Good job. All right, guys, moving on to the next slide. The parasympathetic nervous system. So there's lots of ways that they like to talk about these drugs. They're called cholinergics, parasympathomimetics, cholinomimetics, cholinergic stimulants, cholinergic agonists, and muscarinic antagonists. Muscarinic agonists. So what I want to tell you is that typically you're going to see these medications referred most often in common practices, cholinergic or muscarinic agonist. That's probably the two most ways you're going to hear about them, but we'll talk more about that shortly. So with the cholinergic drugs, muscarinic agonist, there's two different ways in which they actually work. So you have the direct acting that are binding to the cholinergic receptors and they produce the rest and digest response. They don't do real well if we give them to a patient PO. In fact, they are kind of really poorly absorbed that way, and they don't cross the blood-brain barrier. Which, when you find out that direct-acting drugs are mainly used for glaucoma, that makes a lot of sense. The indirect-acting drugs, they work a little differently. So, you know, I told you that sometimes whenever we're talking about synapses, that sometimes the reaction is happening before the synapses, sometimes it's happening in the middle of synapses, and sometimes it's happening after the synapses. Well, what indirect cholinergic drugs do, they're also known as cholinesterase inhibitors. What they help to do is, as the body is passing back and forth this acetylcholine, we'll call this acetylcholine back and forth, eventually that acetylcholine goes away. I'm not a very good magician, and disintegrates, and it actually disintegrates pretty stinking fast. So what cholinesterase inhibitors help to do, sorry, I got to put my ball again, help to do is they actually help to keep this ACH, this acetylcholine, in the receptor site longer. It doesn't allow it to go away. It keeps it in there longer, and so that way the patient gets a therapeutic benefit from that. And we'll talk about that in just a second. So for a cholinesterase inhibitor, I'm going to go onto the side to the right side of your screen first. The reason why ACHE is so important in our body is that we are finding that in patients with dementia and Alzheimer's and patients with myasthenia gravis and patients with toxicity to cholinergic medications, the ACH disintegrates too fast. And so because of that, then they get memory loss. So if we keep the ACH in the receptor site longer for a patient with Alzheimer's, we can help to decrease the deterioration of their ability to think, okay? So that's what we use cholinesterase inhibitors for. Now with the direct-acting ones, the direct-acting cholinergic medications, our most common use for those is for glaucoma. It actually causes the pupil to constrict up, and when that does, that opens up the channel in the eye so that the aqueous vitreous humor has a way to pass back and forth through the trabecular network. The other thing that we use cholinergic drugs for is to help patients who have urinary retention. And then there are certain medical conditions such as Sojourner syndrome that have really, really bad dry mouth. And you're like, dry mouth? What's the big deal? Did you know that severe dry mouth can actually lead to gum disease? And then from gum disease, you get a lot of other things that we can talk about later. But basically, it boils down to it causes permanent inflammation in your body. It can actually cause scarring on your blood vessels. It can cause you to have a heart attack in the long run. So clean your teeth, people. So dry mouth is a big deal. We got to make sure these patients are able to keep their mouth moisturized. So with every medication, we have to have our protocols. And so this is our cholinergic agent class representative, Bethanycol, reporting for duty. Now, for those of you who've been in practice, you've probably never seen this drug. I've been in practice for 20 years and I've never seen this drug. But what they want us to do in the study of pharmacology is they want us to grab onto one drug that has the best representation of this entire class. So if we were to go in and to read all about Bethanycol, what you would see is that it has some side effects, it has some uses, it has adverse reactions. And then if you were to go read about another cholinergic agent drug, it would have very similar side effects, very similar care plans associated with it. So always think about this as being the class representatives. That's what a prototype is. So how are we going to handle prototype drugs in this class? One of the things that you're going to have to do is you're going to have to figure out what's your best method of learning your prototype medications. I will put a picture up online about what I do in order to help learn a representation of the class. This is going to be our prototype for our anticholinesterase inhibitors. Again, this is a medication that I have never given in my entire life, but is a representation of the medications of all medications in that class. It's the one that has all the symptoms that you would be expecting. So when do we give, or what are some of the adverse effects if we gave a muscarinic antagonist? So for those of us who are in practice and we have given eye drops in patients' eyes for glaucoma for years without thinking about it, you can actually have a patient who develops bradycardia if they put in too many eye drops. Hypotension can develop. They're going to have increased exocrine gland secretion. So you talk about like slobbering. We're going to constrict their bronchioles, which can make the exacerbation of their asthma worse, and it can actually cause their hearts to develop dysrhythmias or go out of sync. So if you give a patient too much of a muscarinic antagonist, we're going to talk about what happens next, which is called the sludge factor. So a couple of different things whenever we look at the cholinergic crisis. So this is when you get too much of a cholinergic drug activating your system. So you're like, Ms. Hardy, why do I need to know this? Well, I want to tell you a little secret. They like to hit this on boards. They like to have patients come in cholinergic crisis, and they'll give you a list of symptoms, and then they'll expect that you recognize it as a cholinergic crisis. Some references call it the sludge. Some references call it the sludge effect. You need to know that if a patient comes in a cholinergic crisis, they're going to have salivation, they're going to be crying, they're going to be peeing on themselves, pooping on themselves, lots of gastric distress, and they're going to be throwing up. Well, who gets a cholinergic crisis? Patients who are exposed to organophosphates can develop a cholinergic crisis. Had a good friend of mine, worked for his dad at a local company here in town that sprayed for pesticides. They got a new pesticide to their building, and he actually got some of it sprayed on him. I don't know what happened. I just know that it happened. And what happened with him is all of these things. He came in, he was frothing at the mouth, he was crying, he peed on himself, he's pooped everywhere, he was puking into every trash can he could get, all because he'd been exposed to organophosphates. So you look for it with your pest control guys. You look for it with anyone who is exposed to any kind of a farm, chemical on a farm. They use a lot of organophosphates out there. There's one other person that I just thought about. But if they ever come in, you'll know salivation, lacrimation, urination, defecation, gastric upset, and emesis. There's somebody else I'm thinking about. Always ask them where they work and what they got exposed to. Okay, that's always good questions to ask patients when they come in. Okay, so those are the drugs that all activate your parasympathetic nervous system. Now we're going to talk about drugs that shut your parasympathetic nervous system down. Okay, they can't turn it off completely, but they can shut her down. We do have a lot more uses for these type of medications than we do for the cholinergic medications, in my opinion. I feel like we have more therapies that we use, and we'll see anticholinergics quite a bit, especially in our COPD or chronic obstructive pulmonary disease patients. The most frequent name here that you're going to see is the name anticholinergic. Okay, let me go to the next slide. So how do these medications work? These medications work with acetylcholine, and they actually kind of go to the muscarinic receptor site, and they bind it so that the acetylcholine actually can't hit the receptor site. So what happens when you block a muscarinic receptor site? Let's see. So if this side of the chart tells me what happens when you activate the parasympathetic system, then this side of the chart tells me what happens whenever I block it, okay? So the good news here, guys, is that you only have to remember this chart, okay? So do you see how the parasympathetic side, there's one side that this is what's supposed to be happening, and the opposite reaction is the same as the sympathetic division. It makes studying easier, I promise, okay? Just sit back, chew on that fact, it'll come to you, all right? It's gonna be good, it's gonna be good. Hold on to that fact, hold on. So when we give anticholinergics, why do we give them? Well, we give anticholinergics because we're trying to do these things. We're trying to dilate that pupil out. Instead of making the pupil myotic and really small, we want the patient to experience mydrosis, which is a very large pupil. And we'll use it as a psychoplegic, meaning that we'll use it in the eyes so that the pupil goes big and stays big. It doesn't go like this and then like this and like this and like this. It's called psychoplegia. It'll stop and it'll get really big. We use it a lot during eye surgery. So you think about patients who have that fancy LASIK eye surgery. This is one of the drugs they're going to use on them. They're going to dilate their pupils and then they're going to paralyze them so that you don't go in beer, okay? We're going to use these medications to treat incontinence and overactive bladder. We're going to use these medications to treat asthma, COPD, irritable bowel syndrome, peptic ulcer disease, Parkinson's disease, and sometimes we'll even give it to patients before they go back for surgery. So sometimes you'll see the physicians will give a patient a little, like if they're really like slimy and gooey and all this stuff is coming out of all their orifices, they'll give them a little anticholinergic to draw them up just a little bit. All right, next slide. Okay, so your prototype for your anticholinergic class is going to be atropine. Ladies and gentlemen, I don't care what drug card you use. Pick one, Google it, go to Pinterest, find what you like, okay? Miss Hardy, do I really need to know this drug? And the answer is yes, you gotta freaking know atropine. Some of the other ones I was just playing with you. I mean, like those are drugs that you're just not gonna see that much. They're representations of a class, but you're not gonna see this in practice. You're gonna see atropine in practice, people, okay? We can't get away from atropine. For those of you who aspire to go on to be critical care, flight nurses, ER nurses, and NICU nurses, pediatric ICU, you're going to see atropine. So what do you need to know about atropine? What it does, what it's used for, how to give it, and then what's the bad stuff that's going to happen whenever you give this drug. If it's given in the wrong dose, too much of a dose, if the patient just has a funky reaction, what are you looking for? That's on a drug card. There's lots of different templates out there. Go find one. I did want to provide this little slide to you here, down here at the bottom. It talks about what happens when you give too much atropine. You get hot as a hare, mad as a hatter, you go crazy, red as a beet, flush, and then dry as a bone. Yeah, there's no way of getting away from the side effects of atropine. Those are all the things that happens with an atropine overdose. Next slide. All right, any questions for me today, please make sure you post. Guys, we will keep up and keep track with you. Thank you for going through your parasympathetic nervous system, and we will see you guys on the sympathetic nervous system. See you later.